Welcome to Sexology, a podcast that untangles the science of sex and pleasure. And now, with this week's episode, your host, clinical psychologist, Dr. Nazanin Moali.
Welcome to episode 5 of Sexology Podcast. I'm so glad that you're here with us today, and I hope you had a fantastic week. Unfortunately, I had a very tough week because of the immigration ban in the United States. Although it didn't impact me at the personal level, working with many immigrants and refugees, it was heartbreaking to see what was going on at airports. I attended a protest in Los Angeles County International Airport, and it was fascinating to see that hundreds and hundreds of immigrants and Caucasians were protesting against these bans. And it was very empowering to see that how people were united against this new immigration law. I hope wherever you are, you took some time to take care of yourself. I know I had to take a few days off to process my emotions. Our topic today is understanding gender identity and sexual orientation. My guest is Dr. Abby Weissman. Dr. Weissman is a clinical psychologist and trans-affirmative therapist with specialized training and experience in working with clients who are questioning their gender identity. In our conversation, we talked about the difference between sexual orientation and gender identity. We discussed some misconceptions around transgender women and men, and we explored some of the challenges with use of language and pronouns when working with this population. I learned a lot from Dr. Weissman, and I hope you enjoyed this conversation. Without further ado, here's my conversation with Dr. Abby Weissman. Hi, our guest today is Dr. Abby Weissman. Dr. Weissman is a feminist psychologist with specialized training and experiences in working with clients who are questioning their gender identity and or identify as a person of trans experience or history. Dr. Weissman, I've been looking forward to this conversation. Thank you so much for taking the time to be a part of this.
It's my pleasure, and please call me Abby.
Okay, great. Thank you, Abby. This is an area that many people don't fully understand. So let us start with learning a little bit more about you and your practice.
Okay. Well, I am very blessed to be practicing out of San Diego, California. Let's see, I work with people who identify as transgender and those who love them, as well as on any sort of issues related to people's sexuality or their gender identity.
What an important work, because I feel that there aren't many therapists that have enough experience and training to do that work. So I think that's excellent. That's one of your area of expertise. So one of the questions that I often get from people is just they want to know what is the difference between sexual orientation and gender identity.
Okay, well, I'm glad you asked that question because it is one that I also get a lot because there's an assumption that they're the same. And so even knowing that they're different is fabulous. Got to support that. So in my book, the difference between sexual orientation and gender identity is that sexual orientation is someone's interest in someone else. So their romantic, affectional, sexual excitement, thrill in being with another person. And they could be either of a similar gender, of a different gender, or somewhere in between and among. So they could be lesbian, gay, bisexual. People also use the term queer. And then gender identity has to do with how someone identifies their own gender. So I always hate to define a term using the same term in a definition. So suffice to say, when I think about gender, I often think of the sex that is assigned by the doctor at birth. When the doctor comes on in after a woman has given birth and they say, it's a boy or it's a girl, that's someone's sex. And then the gender is how they identify it themselves.
Okay, so one's internal sense of self would be the gender identity. Is that correct?
Exactly.
Okay.
Yay.
Okay, perfect. And one thing I sometimes find it confusing, and I know I hear that from other people, is that, for example, there was some studies that this specific study was about men who had sex with other men, but they didn't identify as gay or bisexual. So have you had experience with this population? And what's your thoughts about that?
I have had experience with that population. I think there are many populations that their behavior might not match their identity, that someone's identity is very personal and it could be very linked to politics and to situation. And so often when working with Black men, for instance, I might be thinking about if this person identifies as gay, which can have can feel very white sometimes. Or if they're on the down low and they're, let's say, in a relationship with a woman and then also having sex with men outside of their relationship.
Absolutely. And I think you clarified that very nicely because of the politics associated with these things. I think there are some complications and there's a different presentations, because I know in this study, there was some studies like looking into like people inmates and in hospitals and things of that nature. But this specific study, they looked into suburban, like Caucasian male and also bikers. So different subpopulations. So that was interesting to see.
Fabulous. Yeah, I always ask a client how they identify themselves, and that would work because there are a lot of people that identify as gay and they could be of a different gender. They could be women and see themselves as gay, or they could identify in a whole different way. So I'm always, check in with the client first to use their languaging.
Absolutely. I think that is very important to check in with them about what do they identify with, because I think like making assumptions on your own sometimes that's absolutely not a way to go.
Yeah.
The other part of it is sometimes I work with teens and they're coming in because they want to explore and they don't know. And how do you usually go to that route with them?
I love working with teens. They're fabulous. It depends on the teen and it depends on the comfort with the parents. But often I'll bring a teen in and talk with them first, like meet with them first and find out their terms. And so in my intake paperwork, I have a teen form where I ask them, what is your gender identity? And then I give some examples in parentheses. And then what is your sexual orientation? I give some examples because I want to let them know that it's okay and that they can flip-flop around, and having even more than one gender is fine. Having lots of thoughts of their sexual orientation is fine. But yeah, I often let them know I'm using your language, whatever makes you feel safe and whatever terms make you feel the most you are the terms I'll use. And then I notice with teens, sometimes they'll tell me the terms that they feel comfy with me using, but not ever that they have a discrepancy between the terms that they want me to use with them and the terms that they want me to use with their parents.
Wow.
So it's a lot of remembering.
Right.
Yeah.
Right. I would mix that up. I'm not good with like kind of memorizing those things. But as you said, it's very important to acknowledge those things and checking in with them about what do they prefer.
Yes. And I would caution you against the language of prefer. Not because, I hear it in the most like loving, kind way. Sometimes people get grumpy because it's this idea that if I prefer something, like if I prefer to have tea with honey versus sugar, that it's not as big of a deal. So somehow using the languaging around this is how you identify or this is what makes you happy seems to almost give it more weight and more power.
I love that. And I'm reflecting back the language of preference. I'm thinking there's necessarily a choice and just wouldn't kind of take it away from their experience of how real is that.
Right. And also it gives it more power. Yes, exactly what you said.
Perfect. Thank you. So the other question I have is, what does it mean to have a gender that's not male or female?
Well, I think there's many varieties out there. I often quote Kate Bornstein, who said that there are as many genders as there are stars in the sky. And so they have this idea that it's not a dichotomy, that you don't have to just be male or female. You can be in and amongst. You can identify as genderqueer. You can identify as agender, as you can identify as more than one gender. There's lots of options out there. And so that's why in my intake form, I have gender in a blank, because I want people to be as creative as they need to be to talk about themselves.
And I think that's very important. And I feel with gender identity and psychology of gender identity, the more you learn, there are more areas to kind of explore and understand. So that's fantastic that we have this conversation. And it seems like you're an expert in this area. So how did you get interested, and where did you get your training around that?
Thank you. Such an honor to be called an expert. Well, in many places, certainly my own experience as identifying as a lesbian made me want to know everything there is about lesbians. And when I was getting my Bachelor of Arts in sociology, I found I could study abroad and study sexuality. And I thought that was the coolest thing since sliced bread. So off I went to Amsterdam, the Netherlands, to study at the School for International Training. And it just opened up a world of options and possibilities.
Fantastic. And so it seems like you work with this population and with different variety. In your experiences, when would someone first notice that they're like, we have the concepts of cis and trans and the differences around how they identify and their genitalia and things of that nature?
Well, it depends on the person, which I don't know about you, but as a psychologist, I always told myself, I am not going to give that answer. I am not going to say it depends on the person, because that's just so annoying to hear, but I find myself giving it all the time. I can say listen to your kid, which is one of my blog posts around how important it is to notice what your kids are saying, because gender identity itself can actually be discovered at the ripe old age of 2.5.
Interesting.
So I've certainly had parents come to me when their kids were that young or slightly older to ask, oh my gosh, is this what's going on? And at that point, I would encourage them to just, watch the kid, look for patterns, follow the kid's lead.
And
it can be pretty early.
Yeah. And I can imagine for younger children, it's a blessing that they realize understand about their gender identity. And if I know sometimes when they are identify with gender minorities, they're subject to bullying and lots of stigma and things around that. And how can parents support their kid around those issues?
I think it's a great question that you ask, and it's a really big one. I think that supporting your kid for me means listening to your kid, even if they don't say the things that you want them to, and really hearing them where the kid is at. I encourage parents to get their own support and their own education, like going to PFLAG meetings around them, where they can learn about different identities, different gender identities, as well as different sexual orientations. And then in terms of bullying, I really, really, really underline little stars by it, love the work that GLSEN has done around school bullying, where they have different programs that they've worked with different schools on. And they'll have, what I love about them is that they'll have like a list in California of all the students' rights.
Oh, fantastic.
And then they'll go into the school and help educate the students on what are your rights, what are the ways that we can advocate for you, and then to know that a parent is right there on their side is wonderful.
That is that is a very important resource. I'll make sure that I include that in the show notes. And I live and practice in California as well. And even in the modern area, it's like people are more open-minded, and school district around, you would think in California, but still similar kind of experiences I experienced. My clients experience lots of bullying kind of issues at school, and there are lots of struggles.
Very much so. And my heart hurts for your clients, my clients, friends, colleagues who have to experience so much. And they're lucky to have you to advocate for them. I think the real thing I would say for parents is to get their own support so that they don't have to rely on their kids to educate them.
Absolutely. I think that is very important. The other question I have is about transgender. What are some of the misconceptions that you hear that people have around transgender women and men?
I think the main misconception is around that they're not this concept of real man or real woman. And I think as long as someone identifies as a woman or as a man, to me, they're as real as they can be. And that's a really big deal, to be an authentic person, to really figure out who you are. It's such a wonderful thing to see someone come to terms with who they are. And yet there can be such a fear that they don't look a certain way that makes them not the right way, as if a woman or a man can only look a certain way.
Absolutely. It can be very challenging, but as you said, like it's a journey that can increase one's understanding of themselves and their environment. So I often see that sometimes it adds depth to one's personality when they realize about who they are truly.
Very much so. And I think I also think about, how difficult it can be to go through life identifying with a gender that you weren't assigned as at birth. I mean, there's the whole bathroom calamities where in California, there's a little bit more lightness around giving different bathroom options for people. But it still can be very uncomfortable to figure out where to go, especially in spaces that are gendered. Like I'm Jewish and there are only some synagogues that I attend, but I'm always very cautious of where do the women go and where do the men go? And how do I know where to go? Like, how was I taught where to go? And then what if there was someone else whose gender might not look as clear-cut as mine supposedly does? How would they feel comfortable? What clues would help them feel safe and not scared? So...
Yes. And I think, as you said, that like these daily decisions that people make can be very challenging when you're not fitting in this like cookie cutter male and female kind of like cis identifying kind of thing. So that's very important. Yes, absolutely. One area that I always had question, do you do the evaluation for the surgeries and people who are interested into about like getting the surgeries?
Yes, I definitely do. Although it makes me sad that I have to. In Southern California, any person who was identified at birth as female and still identifies as female, any cisgendered female can go and get a breast job or can get a reduction without any sort of letter writing. But once I have someone who was assigned male at birth and wants to transition and wants to get breast implants, then there's a whole big thing.
Absolutely. I didn't think about it that way, but that is so true.
It's like or a nose job versus face feminization surgery. I mean, I'm used to my culture of like Jewish women where, not for everyone, granted, but the stereotype was around on your 16th birthday, you would get a nose job if you were white and of a certain class. And yet here, to get someone to have facial feminization surgery, they would need a letter from their psychologist letting the doctor know that somehow they're okay enough.
Absolutely. And I did my postdoc at a place that was more medical setting, and the barriers for people for getting the surgery was very challenging. It was a month of therapy and evaluation and going back and forth. So I can understand that, as you said, there are some more barriers than it needs to be.
Yes, I very strongly, with wild cheering, agree that it really doesn't need to have as many barriers as there are. And I think depending on the state you are in, might have different recommendations, and depending on how comfortable the medical doctor feels about performing whatever surgery it is or whatever experience they have, might determine how quickly the process can go. But as you probably know, if you need hormones or you want hormones in your life, you do not need a letter from a psychologist or a therapist at all. And so often I get calls that are like, oh, will you write me a letter? And I'm like, oh, well, yeah, of course. For what? What do you need it for? And they're like, oh, I just need hormones. I'm like, no. I will give you the names of clinics. Like, you just go and take care of yourself.
That is
It's
fantastic
okay.
that you're so passionate about this job, that you're constantly educating people.
Yeah. Oh, thank you. Yes, I feel like I'm learning myself all the time. I think spending a lot of in grad school, I was up in the Bay Area, and so for us, we could just send people next door to go to the Tom Waddell Clinic, and it was considered harm reduction to have people get hormones that were prescribed by a doctor or medical care, so that they didn't have to go find them on the street and get unregulated hormones. And so then to come to Southern California, where it's like, okay, there are 2 clinics you can go to, and we can take care of you there, or let's find a doctor that works with your plan. Like, it's a lot more work, even for hormones that I'm used to just being like, go. So I find that's tricky. And then I find that there are some clinicians that won't write letters for their clients, and that hurts my heart too.
Like they kind of like because of their own biases, or what would be the reason like that usually that you see that?
I think it depends on the clinician, I would say. I would like to think they all have good intentions, but I'm not really sure if that's true. Maybe they just don't feel like they can, like they need additional special training, which, I'm happy to provide or happy to send them to where I got trained, or that they feel like it's mutilation. And so they just have really negative feelings about medical interventions that they're not like sharing with their potential client while they're in the phase of, are you the right therapist for me? I see a lot of people that get stuck working with a therapist who is like, just 6 more sessions, just see me another time, and then we'll talk about it. But they don't necessarily just write the letter. They'll make them wait. And I just think that's cruel.
It sounds
and expensive.
Like it. Absolutely. I know therapy is an investment. And, I feel with kind of evaluations to that, I think you need to have the training. But if you don't have the training, it's not going to have anything going to change in 1 session or 2 session. So that would be like good time to refer out. So I can understand the frustration.
I guess this is where we might differ. So I'm torn. On one hand, I love seeing people. So yes, send your people to me. On the other hand, I find it could be really traumatic for someone to work with their provider, finally feel safe and comfortable enough to share this part of them, share a different gender identity or even a different sexual orientation, and then have the provider be like, oh no, I can't do this. This is too much. You have passed some threshold, I can't do this anymore. Let me refer you out. And I feel like that's sort of a way of saying like, you're too much for me.
Absolutely. I can see that you were thinking like, might all feel kind of like, I trusted you and you couldn't like, you can take it, or also like kind of a experience, like some people might experience a rejection. Yes. My thought process on that was, I remember the training that we had at the hospital, and it was like, they were talking about the evaluation, and it was just so many different steps, different things were involved. So I felt like, this is like, if I ever needed to write a letter, I should be familiar with like these 20 assessments and had experience and all those kind of things. So I think fear of not being competent necessarily in that evaluation might be something that like, would, hold me back. But I can totally understand that from client's perspective, especially around the sensitive topics such as, and delicate topic around like trusting you and discussing your gender identity. It can be very invalidating if I say, oh, no, I cannot do that. I can deal with depression, anxiety, like all trauma, but this is something different.
Right, exactly. I think that's the fear. And I would say for me, I think I have been very, as I said, very lucky to be trained by wonderful practitioners throughout my training. And at the end of the day, there's this idea that I don't believe that I can pick for this person what's right for them. And so it's not actually that intense of an intake. It's like an intake. Sometimes it takes me a little longer to type it up. I'm not as speedy. So I try to do it within maybe 2 sessions. And then if it's more complicated, a little bit more. But as long as I have access to, speak to the other doctors that are working with them or check in with them about their aftercare strategy, it's okay. And I am really grateful to have a lot of people I can consult with to make sure that I'm doing right by them. But I will say when I first got licensed, which granted it's been like a year ago, I had people who scared the bejeebies out of me. I don't know if that's an appropriate term. They scared me. They were like, you are going to lose your license if you do any sort of assessment and you haven't seen the person at least 6 times.
Oh, wow.
You are going to lose your license if you're not in therapy with them for at least a year. I'm like, what? This doesn't seem right. This doesn't fit with my norms, It's a population that often doesn't have a lot of money. So I'm going to make them pay for a year of treatment when they don't even want it. They just want to get the surgery that would make them feel the best. That feels wrong.
I can totally understand that. And I love how you're advocating for more patient and kind of encouraging people to follow the leads of what patient wants. And
Yes.
I think that is very important.
I agree. I will also say I definitely utilize the WPATH standards of care. We're up to standards of care 7. And then the ICATH, which local colleagues let me know about, which is more about, I can't think of the word exactly, but it's more about supporting the people making the decision for themselves that they need this kind of care, and then advocating for themselves and asking for therapists to help them in certain avenues to get them access. So I prefer to go that method, but if a doctor or physician or surgeon won't go that direction, then I will follow up and use the WPATH standards of care.
That's wonderful. It seems like you have different options and like you have different training, so you can like kind of pursue them based on the need of the client, which is great. One question that I have is there about like what pronoun to use with someone who they don't like. You can, when sometimes I can be honest with you that people coming in and I feel like I don't know what would be a right pronoun, and like English being my second language, sometimes I by nature confuse the pronoun. So how would you know what pronoun do you use for your patient that are transgender, or like what our people's preferences are?
I will say, taking from my dissertation, which focused on the experiences of people identify as transgender and Jewish, I would say most of the people said this, which is ask.
Okay.
Ask with kindness and respect, but ask.
And there are, I feel it's a language that people need to kind of master because there are a number of different variations. And so if someone want to kind of increase their understanding about the language they need to use and the terminology that are respectful to, so you think it's the best way to ask the people, obviously. Is there any other research around that or any books that people can read to kind of increase their understanding of people of like different gender identity and sexual preferences?
Yes. To give you a really simple answer, yes. I do want to say a quick caveat. And the last point was, I will say most people, if you ask, like, what pronouns makes you happy is how I usually ask when I'm meeting with someone. There will be most likely 1 or 2 people who will say what you can't tell and will get grumbly about it. And that's their right. That's their identity stage. That's where they're at. And to follow up, I usually say, I just want to make sure I don't want to assume anything. And that usually helps kind of regroup everyone together a little bit, that you're coming from a state of, I don't want to assume, not I'm curious because I want to ask you all these invasive questions. And that helps them.
Absolutely. I think it's important to kind of, as you said, ask people, because when you there was one occasion I remember that I didn't ask and assume, and that was like when the person like corrected me, which they had all the right to do that. I'm glad they did. But then I was just kind of like, I felt shame. But again, I wanted to make sure that like, then from then on, I realized that I always ask because I want to make my clients comfortable.
Yeah, I think it's awesome that you ask. I have made so many fumbles and blunders. Like I feel like for as much learning as I've done, I always feel like I make some blunder along the way. And who knows, maybe it'll become some moment where you connect with the client. Remember that time I used the wrong pronoun? Well, thank you so much for correcting me. Absolutely. I feel like I have a better handle. I also tend to ask clients who are in the middle of their kind of figuring out who they are, what pronouns make them happy. And I ask them most sessions.
Oh, that is so neat. So you're checking with them every time, kind of like what's their what's
See, we're both doing it.
No, but I love that I'll keep that in mind. So what they want to get called. And so that's wonderful.
What they want to get called. And then like, do you have a name that you've been thinking about? Because that can be really hard. I don't know. Figuring out my own name, my nickname was hard enough to figure out Abby and not Abigail, not Gail. Then to create a whole another name for yourself is a really tough thing to do. So sometimes I'll just check in and say, I have to write these notes. As you know, it's my legal responsibility. What pronoun would you like me to use in these notes?
I love that. And that can be very empowering.
Yes, I think so. And then with your parents, let's say if it's a teen, what pronoun would you like me to use with them? Okay. And I usually ask, is there anything you'd like me to advocate with your parents around?
Oh, I'm sure they love that.
I say, I can't get you dessert for dinner, Like I try, but I'm just not that cool.
That is wonderful. It shows that it's clear, Abby, that you're very passionate about this population and you're advocating for them, which is wonderful to see, especially in this age and time with all the discrimination and all the struggles that people of sexual minority experiences. So if our audience wanted to reach out to you, what would be the best way to contact you?
I think the best way would be, I have many best ways. They're welcome to try me on my website. I have a bunch of links there to contact me, and it's www.doctorabi.com, or they can call me at 619-403-5578, or again, they can email me at info@drabby.com.
Perfect. I'll make sure that I include those information in the show note. Thank you so much for your time. It's been a pleasure. It was a pleasure to talk to you, and thank you for sharing your expertise and knowledge with our listeners.
My pleasure. Thanks so much for having me. What an honor.
Thank you. I hope you found our conversation helpful. Like many of you, I didn't grow up talking about these issues, and I often find it very challenging to learn and expand my knowledge in this area beyond what I learned at graduate schools and books. And I really appreciated Dr. Weissman's openness and kindness so we would be able to learn more about this topic. Please, if you have any questions, feel free to contact her directly. At the end, I want to take a moment and thank those of you who wrote honest review for this show in iTunes. If you have a moment, I really appreciate if you go ahead and write us a review. I'll see you soon. Thanks for listening to the Sexology Podcast. For more great content, visit www.sexologypodcast.com. Please be advised that information presented on this podcast is not a substitute for seeking help from a licensed mental health provider.